Welcome to our session regarding the initiative from the Portuguese Presidency on removing existing barriers to cross-border telehealth in the European Union, focused on the member state perspectives. I'm very grateful to the Portuguese Presidency of the European Union for hosting this event in the context of the eHealth Summit. So we are most grateful to be here with you. My name is Duarte Sequeira. I'm the director of the National Telehealth Centre here in Portugal for the shared services of the Ministry of Health. And I have the pleasure of moderating this roundtable. So it's an honor to me to introduce you with Ana Carriazo. She's a senior advisor in the Regional Ministry of Health and Families in Spain and in Andalusia in Spain. Javier Quiles del Rio. He's head of service of management of projects of information systems in the Galician healthcare services in Spain. Annemieke, Åleniu, she's a deputy director general for the Swedish eHealth agency. Then we have Eamon Coyne. He's an enterprise technical architecture lead for the health and safety executive in Ireland. And Caitriona Wray, she's higher executive officer for the Department of Health in Ireland. So thank you all for being here with me and with all the people that are seeing our session. We'll try to make this next half hour exciting for everyone that is assisting our session. Today we will discuss the Portuguese Presidency initiative that we have been developing in these last 5 months regarding the removal of the barriers to cross-border telehealth service in the European Union. So we have been discussing the importance of this service to citizens and healthcare professionals, as you know, as well as the barriers hindering this deployment. So I will start with my first question for you, and I think I will start with Ana. So what is your view on the benefits of cross-border telehealth service in the European Union without barriers? So why should we advance these services? Could you relay some of the telehealth initiatives that have been developed in your country or region that could be leveraged for cross-border services? So I'll start with Ana. Thank you.
Thank you, Duarte. This is a great question because I think that the main benefits are for the patients and the people that live in Europe and across that can be moving throughout the whole territory of the continent. And the healthcare has to respond to these needs of the patients in every country. It is true that patients live in a place and they have the healthcare in that place, but they move. And the healthcare has to be guaranteed. It's for the benefit of the patients, mainly. And also, I think that it has a very strong component of benefits for healthcare professionals that are can assure a continuity of care for patients across borders, and also for the systems, the healthcare systems and services that have to provide and assure the way the information is provided for the patient and the professional. So, but I think that the main benefit is removing barriers for patients and assuring their safety traveling and continuity of care. And we have, I think it has been a very inspiring experience participating in this proof of concept that we will have the time to comment on that later.
Okay, thank you, Ana. Also in Spain, Javier, can you share with us some thoughts on this?
Yeah, sure. Well, I also agree with Ana on her experience. And well, regarding telehealth, we think we also should address a little bit which kind of telehealth we are talking about. But if we talk about telehealth of professionals that are attending the patients in a remote way, well, we also had some previous experiences based on telephone calls. The Galician healthcare service started doing telephone calls for primary care visits. I think it was maybe 3 years ago, maybe 4. And 15% of the visits in primary care were done using the telephone calls. And also, as Ana has mentioned, the citizens are really pleased to have access to this service, because in a number of situations it's much fits better for purpose. And if we talk about telehealth, about contacts between professionals, primary care, talking to specialists in hospitals, we also have very high numbers in some specialties. Dermatology, ophthalmology, they're very, very used to use this telehealth way of communication. So in our house, it's working. So the challenge is now to take this over and to make it also available in a cross-border situation. So the experience that you brought up with your proposal from Portugal, I think it was very useful to understand that this is feasible. And now the challenge is to put it in a scale, I think. So I think we have the background is ready. So we have the floor, and now we have to build up this new scenario. And I think it's feasible.
Thank you, Javier. We will expand on that later this session. Thank you. What about Sweden? Annemieke, can you share with us some thoughts on this?
Yes, of course. I think it is absolutely in the benefit for the benefit of the patient to be able to get use of telehealth, but as well as also for the society as a whole and for the professionals as well. I'm especially thinking of highly specialized care, for example, where you only have a few patients maybe who need this care, rare diseases. If you can treat more patients, you will become better in your work and so on. So I think it's also for the benefit of the professionals and for the society as a whole. A lot of healthcare is quite expensive. We are able to do more and more things, and economies of scale are for the benefit also for the economies in our different countries. One thing I would like to highlight, and now when we're in the pandemic, is the increase in remote working. And I think, well, living in the north and you are in the south, it's very, very nice to be in the warmth and maybe being able to work there as well. And then the need for getting healthcare in another country is also increasing when other developments in society are changing. For example, the way we work. Thank you.
Thank you, Annemieke. Eamon, in Ireland, share with us some thoughts on this also, please.
Yeah, no problem. Like telehealth services, today's climate are essential. I agree with everything my colleagues have said. You know, they ensure access to high quality healthcare services. It affords the citizen and enables them and convenes them. So you have greater patient satisfaction. It reduces the unnecessary travel from the citizen's perspective. And then from the service provider's perspective, you know, it has improved clinical workflows. It reduces the number of no-shows. So particularly for people that have challenges getting to and from healthcare facilities, be it domestically or indeed cross-border, as we're talking about now. And for the healthcare professionals, it also gives them a wider range of access to patients that they ordinarily wouldn't have, particularly when we talk about the cross-border scenario.
Okay, thank you, Eamon. Caitriona.
You're welcome.
No, just to echo everything that everybody said, the patient always has to be the centre of everything that we do. And I truly believe that this proof of concept shows that we are putting the patient in the centre. And again, I'm a big believer in the reduction of unnecessary travel and tests and the collaboration of all our healthcare professionals across all different teams across all member states.
Thank you, Caitriona. Caitriona. We will now move for the specific challenges. I will just have some background information on our experience on this pilot that we have been doing. So for the ones who don't know, during May, we were able to deploy a proof of concept showing that it's possible to adapt a teleconsultation platform to allow two healthcare professionals, for example, to share knowledge and expertise and ensure the continuity of care of a set of use cases. For example, unplanned care for patients that suffer an acute episode with need for immediate care in one member state and a post-follow monitoring on his or her member state of residence, for example, a stroke, epileptic episode or something like that. And then a second use case that is the need for monitoring chronic patients that work in a different member state than the one they were born, but are being monitored in two different healthcare systems, which is a common reality, or can be a common reality for different citizens across Europe. And we also discuss the need of continuity of care on the ongoing international mobility agreements for planned care that allows a citizen to receive care and treatment in another member state when not available in his or her the residence member state. So these initiatives showed us that through cooperation, we can really promote the discussion between two physicians in a safe and cooperative environment, showing that telehealth services can be feasible in terms of technical feasibility. They can improve, as you all said, patient safety and access, and also facilitate interprofessional communication, and we think that has shown to be a valuable tool for enhanced continuity of care. However, as I was saying, we still face a lot of challenges, and that's those challenges I would like to hear more about from your perspectives. So now I will do in reverse order. I will start with Caitriona. So what challenges need to be overcome in the near future to allow a real scalable deployment of telehealth services across the European Union?
Thank you very much. We have seen that through this consent-based proof of concept, the value in what telehealth technology can deliver. I think it also highlights that the legal, organisational and financial supports are needed to operationalise the service. So to me, they would be the biggest barriers.
Okay, thank you, Caitriona, for your perspective. Eamon, back to you.
Yeah, no problem. So as Caitriona said, we need to overcome the legal and the organizational, and I know through the workshops that SBMS have facilitated, those topics have been covered very well, and there was some good outcomes and recommendations. The technology, we've proved it, as Caitriona has said, and we've seen the benefit and the value, what we can do with the technology based on the great work and the foundational work that SBMS have done and enabled the other member states to do. So I don't see technology as the biggest challenge for us today to overcome and to bring it to a wide scale deployment. I think the challenge is to get the more formal agreement from the Commission based on the outputs from the work that we've done to allow us to bring it forward in a more focused, consolidated, collaborative effort, and some more official recognition to the work package to allow us to continue, to be honest.
It's quite interesting, Eamon, because in the past, technology was really the one was blamed as the biggest challenge, and now we see that technology is here for us to use, and the other aspects, I mean, people and processes, the two main challenges. Okay, thank you, Eamon. Annemieke, what would you like to have on this?
No, but I think also it's very good to have this system that professionals can discuss together with the patient about the treatment they have gone through and maybe the follow-up and so on. The problem is often, if you're talking about planned care, that costs and benefits are not arising at the same place. So those who benefit from this contact, they are maybe willing to pay, but others who do not have any benefits from it, they prefer to use the money to something else. So I think the problem is healthcare is facing a lot of economical problems. It is the means are really not sufficient for the needs. So everybody has to make a priority, and then the question is if this gets the highest priority because it's not used for the majority of the patients. So I think we have to find a way to get financing for this, because the hospitals and the organizations themselves probably won't prioritize this. We have to enable it, make it very, very easy to use, because they don't use it that often. So therefore it should be very user friendly. That's more about the communication platform we have been talking about concerning professionals and patients, but otherwise sending information like patient summary and e-prescription and lab data and so on, laboratory data, there we are working on we're working on that in the EU. But I think there are a lot of benefits also within a country. I mean, we can't assume that all countries have a national system where professionals can communicate with each other in a safe way, because I don't think all countries have that.
Yeah, that's quite interesting, because in some countries there are different regions who can really collaborate. It's inside the same country, but within different regions. Okay, thank you, Annemieke. Javier.
Yes, sure. Well, of course, I agree in these main issues about legal framework and also the financial support. I think it's quite important to have a clear framework for that. But well, I will disagree a little bit, because technology, I mean, is not a barrier. Today, I think we have a very, very good quality infrastructure. When we talk about technology, we can connect almost from everywhere, and also using 4G and the coming 5G. But I think we need a better support from information systems. I think we have a legal framework now, where we have a regulatory statement from the Commission. We also have some recognition in our national legal framework, but I think that the process is not fluent. It is not so easy to see the information we need to see at the right point. So I think some more efforts should be done in information system integration. And I think we have an initiative that is supported by CEF, is funded by the European Commission. But if we want to go a little further and go towards a telehealth interoperability system, we should also overcome some of these barriers. We have to improve our information systems on this direction.
Thank you, Javier. Anna, also from Spain, your perspective.
In this case, I will speak on the last, and being the last. I think that there is a lot of challenges that we have to face to put these telehealth services in real operational mode, as has been said before. During this pandemic period, and hopefully we are facing, or we are close to the ending of this being at home and not having personal contact, has put everybody in the necessity of contacting by other means. And contacting your healthcare professional by phone has been the priority during this year. In the case of Andalusia, the proof of concept was based on the Andalusian telestroke network that is already put in place and facilitates the care of stroke in the territory, thanks to the use of resources that are limited and the connections and the awareness of the different neurologists and vascular neurologists and radiology services collaborating together under the same scheme. And with that, we were able to contact the Portuguese platform. We have national or regional platforms that need to be connected. As has been said, technology is not a problem, but it's also, we need to be aware of the different regulations and the way of connecting and the interoperability of those systems, the processes in place, the organizational aspects, because I think the willingness is there, and all health professionals want the best for the patients and to treat the patient when they need that. But the technology has to support, and we have faced several, we'll say, limitations due to the corporate network. We are facing similar difficulties when there are some kind of unwanted attacks to the health system and technology, and we need to be aware of that and because the health information is very valuable for everybody. So we need to advance in that direction, make things easier for the professionals, and they already collaborate, but they have through secure and trusted channels that you need to know that the professional that you are talking to is a professional from a trusted entity, and it's not somebody that is coming in at that moment. So we need to advance that, and probably we need to advance on some language barriers, because we can speak here in English, but at home we speak in a different language.
Language is an issue, of course.
My colleagues from Galicia, they speak very similar to Portuguese, but it's not the case of Andalusia. But I mean, it will be another challenges to face in the near future.
Thank you. Okay, Anna. I'll move to my last question, and it's linked with your considerations. So we all know that with the pandemic, there were a lot of barriers that were surpassed. And other challenges have been shown to be really important to face. But we all know that the sustainability of telehealth will depend on the actions that all the decision makers, both in member state and in the Commission, will have to do to determine if the full potential of telehealth, specifically in this context, in the cross-border way, is realized and can be realized after this pandemic crisis has passed. So my question now is, what specific call of action would you like to highlight for the medium and long-term future in terms of cross-border telehealth? I mean, in your perspectives, what could be like the desirable and minimum viable product and feasible feature in the medium and the long run for the development of cross-border telehealth service? I will start, I think, can be with Annemieke in the middle.
Thank you.
Thank you.
Thank you very much. I think what is very important, which I wanted to stress, first of all, I think we have to work much more with digital inclusion, because if we want to have the patients involved, we know that a lot of patients, they are in particular groups and they are not always digitally included. So we have to work very much with that. And then for the second part, I think we have to work more with interoperability, real interoperability. So continuing the work that we are doing. And thirdly, I think we have to work with security, cybersecurity. And in that last point, I think the initiative you have taken with trying to create some kind of a communication platform is important, because now it's not that the physicians do not have any contact with each other today. Of course they have, but they are using a telephone, and it's very easy to just it's not safe using a telephone. You may be sending emails to each other with information instead of using a safe net. So you have to work with those. I think those three: digital inclusion, interoperability, so that we really know that we're looking at the same kind of same kind of material for making your decisions, and making a secure way of communicating with each other would be a good priority.
Let me just question you on the digital inclusion, because it's quite important. Do you have specific initiatives that you would like to give as example for these components in terms of digital inclusion? Do you have a specific project?
Well, in Sweden, we are very much working with trying to include the elderly, for example, because the elderly will also be those who need most healthcare. And if we can keep those people for the first of all, that they don't get sick, that's very good. So to work preventive, when they get sick, try to give them care at home, remote care, and other kinds of care. And when they come to the hospital, try to treat them as quickly as possible. And remote care and preventive care, they are very much based on digital solutions today. And I think we also have to work much more with we are very much talking about healthcare, but we must integrate it together with social care, because it's not a straight line between those. They're interconnected. So I think the elderly are an important group, people who have some kind of a disability or which need care. So and those are also the groups who are very often not included digitally. So different kind of education, some incentives.
Okay.
I think that's important.
Okay, thank you, Annemieke. Eamon.
Yes, I'd agree with Annemieke says there in relation to developing interoperability. Okay, sorry, my apologies about that.
No
I'd agree with Annemieke in relation to deepening the interoperability and the security in terms of our own national deployment. And we've had great success with the deployment of telehealth services across the acute, across a varying number of specialties, and in the community setting across a number of different services, audiology, psychology, social work, physio. So then with this proof of concept with our own healthcare professional, we can see that he was very excited. Dr. O'Shea was very excited about the possibility for extending that to the cross-border scenario. So that was a great experience for him. So in terms of the medium term, I think we should capitalize on the success of the pilot. I think we should broaden the use cases where at all possible. We should deepen the technologies that Annemieke had said to take in the process, and as Anna had said, in terms of the process, the workflows that are needed to bring the use cases to life. As Javier has said, we have legal and organizational support in terms of some of the derivatives that are there. And then in the longer term, I would see us bringing it to a more formalized approach in terms of the EU funding for those member states, because as Annemieke had said, sometimes it can be difficult to get funding. So if the funding was available at the European level for member states to avail of, it will afford us the opportunity for that collaborative approach across the telehealth services. Thank you.
Thank you, Eamon. Caitriona.
Thank you. Just to echo Annemieke there in relation to the digital inclusion, as most of the audience of this meeting would be aware, there was an eSkills for Professional deliverable from the eHealth Action, and that it included recommendations for both the citizens and the healthcare professional, where there would be a competence framework for the professionals and the suggestion that maybe digital skills would be improved at, say, a primary school level, rather than at university level where it would only hit the professionals. And by doing that, it raises awareness then for the citizen. And also in relation to longer term, it could be possible that a joint action on telehealth, because it is such a massive subject, would be possible in the future, where it would be solo on telehealth as opposed to dragging in other areas and initiatives. So it could be something that the Commission would like to look at more on a longer term basis to try and get over all the barriers and maybe identify anything else that is outstanding.
Yes, maybe creating specific digital services, I mean, for specific services, not in a general way. Okay, yeah. Thank you, Caitriona. Anna.
Yes, thank you. I think that this digital inclusion, digital literacy, and digital literacy in general is a very important issue. And another point that Caitriona was mentioning on the need of specific funding for telehealth services in the future, to take advantage, as Eamon said, of the reality, the feasibility of the proof of concept. It has been a successful experience, an experiment, but we need to expand this to the reality of the day-to-day basis, on a daily basis. I think that for that we need trust in the system, trusted links to connect among, and I think that for instance, it was mentioned before the useful of using for a specific and very specialized treatment, like in the European Reference Network, connect telehealth to the European Reference Network for the Commission may be a good idea. I would like to add that in the Andalusian telestroke network, there is an average of 100 patients being taken care of during the month, and each month there are an average of 5 patients from outside Andalusia and from outside Spain. That means, through these 2 years of running of the service, 86 patients were treated in this. It's a reality, and thanks to having this network connected and with it's feasible and it's possible to treat this patient, and most of them, of course, come from Europe. People visit us in Andalusia. So I think that this connection with other actions like the reference network, the teleconsultation, and I think that the professionals and the system need to have trust in the service, in the technology that is provided to give the services. So I think that working on that will help the advancement in the coming future.
Thank you, Anna. Javier.
Okay, thank you. Well, now I'm the last one, so I think it's the most difficult part.
You can help me wrap up.
Perhaps I would like to. So yeah, of course, I agree in a number of almost every issue that you have already mentioned. But answering to the specific question, while we were speaking, it comes to me once and again the project of interconnection of patient summary and e-prescription that is in place on almost every country nowadays. It's the CEF initiative. And I see in the medium term or short term that implementing telehealth services could be really a natural way to go on with the CEF initiative. I mean, now we are able to do interchange of patient summary. It seems somehow natural to allow a clinician that is reading a summary to write to another professional and to say, okay, now I have written this on this patient, now you can have a look at that. And I can answer you to your question. So implementing some kind of telehealth services on the CEF initiative, I think it's more or less feasible in the medium term. And looking to the long term, I see also that the language barrier is also an issue, because a number of professionals may be able to have a good command of English. Of course, between Portugal and Galicia is somehow easy to get contacted and to get connected. But language is also a thing we should look to a kind of online translation support for languages that make this easier for a number of professionals. So
okay, thank you, Javier. We are short of time, so I will try to wrap up the session. So I think we are all motivated for this, as I understood for your intervention. So that's one of the most important things in this kind of project, because it's not just a dream, as Anna said. You stressed out the digital inclusion aspects that are quite important for the patient perspective. Also, the continuity of care. I mean, having these care plans work together in a good patient journey, so that the patient really feels has a good experience with this kind of exchange. You also talked a lot about interoperability, technical and semantic, specific funding, the importance of cybersecurity, and also the legal and organizational aspects for putting this all together. There was a specific recommendation on creating a joint action on this. So I think that's it. Thank you all for being with us today. I hope everyone else at home would like and get motivated for these, for helping us getting this dream a more scalable reality, and not just specific pilot projects. So thank you all for your time today, and hope to see you soon.